Assalamualaikum and good day to everyone. We are Group 3 and our topic of presentation is about food safety. My name is Muhammad Adi Rashidi Muhammad Yusuf and my team members are Nurul Iza binti Yusmi Hanif, Nurul Amira binti Saha and Ayuzafina binti Zamani. As an introduction, food safety is one of the most important aspects of human survival. In 2019, the Australian Institute of Food Safety defined food safety as an early preparations at handling and securing food in order to reduce any risks of sickness and illnesses caused by foodborne diseases. Unsafe foods can contain harmful bacteria that can give many unwanted side effects or sickness. Ever since the occurrence of the Covid-19 pandemic, many people have become paranoid with the cleanliness of many things, especially due to the lack of knowledge on how dangerous the virus can be. According to the World Health Organization, the United States Centers for Disease Control and Prevention, and other public health organizations, there is no solid evidence that proves that the Covid-19 virus can spread through food or food packaging. However, this does not change the fact that the virus can still be transmitted through other means. Therefore, in the context of Malaysia, many changes have been implemented and enforced by the government of Malaysia in helping the food industry maintain an acceptable level of cleanliness and safety of food.
Assalamualaikum, I'm Nurul Amira. I will continue the presentation of Food Safety Policy, which is the Food Act 1983. In Malaysia, the Food Act 1983 are in charge of regulating food quality and safety. The Ministry of Health Malaysia, specifically the Food Safety and Quality Division, is responsible for protecting the public under this Act. According to the Food Act 1983, the objective is to protect the public from health hazards and fraud in the preparation, sale and consumption of food. Malaysia is moving into the transition to the endemic phase after more than 2 years of facing the challenge of COVID-19 pandemic. The objective of the enactment of the Food Act 1983 during the pandemic transition to COVID-19 endemic remained the same, and there were few reforms which was to curb the effects of the COVID-19 pandemic. However, food safety and quality is still taken seriously. Next, a few strategies in implement this act. First is make regulation to implement the provision of this act. Based on the Food Act 1983, in Section 34, states that the Minister of Health can make regulation to implement the provision of this Act. The food regulation is a law enacted under the Food Act 1983 enforced by the Ministry of Health Malaysia and local authorities. During the early pandemic COVID-19, the Health Ministry viewed seriously the selling and advertising products using prohibited claims and made some regulation based on Food Act 1983. Statements such as helping to lower blood pressure, increasing metabolism, able to reduce the dangerous illness or able to prevent from being infected with COVID-19 and so on are prohibited on food products label and advertisement. Section 17 of the Food Act 1983 states that it is an offence to provide misleading labelling and advertisement of a food product. Besides that, under Sub-Regulation 18 under this Act, food labels should not contain health claims such as preventing, reducing, treating, and curing any disease. In the transition of pandemic to endemic COVID-19, regulations made by Minister of Health to implement the provision of this Act provide infrastructure that can control the cleanliness of food premise and food safety in the country to protect the health of the people in the country in order to prevent the spread of COVID-19. It must be complied with to protect the public, so the food produced is safe, quality, clean. To protect the public, so the food produced is safe, quality, clean, and free from contamination and COVID-19 virus. Besides that, another strategy based on this aid is implement increased knowledge and awareness to improve food safety about the food aid. In the pandemic COVID-19, Health Ministry organized the national level clean and safe market competition to raise awareness among traders on the importance of food safety and hygiene. The competition was aimed at increasing awareness among traders on the importance of food safety and cleanliness. During the pandemic, all activities such as campaigns, talks, webinars, and so on mostly are only done online through applications such as Google Meet, Zoom, and more. After the end of pandemic phase, the activity is allowed to be done face-to-face. For example, the Ministry of Health Malaysia established the International Food Safety Training Centre. This training center was established based on the Food Act 1983 under the Food Safety and Quality Program, Ministry of Health Malaysia. Besides, for the purpose of offering short-term technical training in the field of food safety and quality to the local and international public, especially the food industry, this training also can increase knowledge to improve food safety about the food aid. The training recommended by this training is carried out by competent and experienced officers to ensure that participants receive hands-on knowledge and training in related fields. Among the activities that will be carried out are food safety training for auditors, food service supervisors scheme training, product labeling, and hand-on conducting food safety and more.
Next, we go to the challengers. In order to protect the safety of the people from the COVID-19 virus, the Malaysian government has established a movement control order, which is MCO, to reduce the spread of the virus among the citizens. Various types of security are tightened according to the standard operating procedure that have been enforced by the government according to prescribed phases. However, there are challenges that need to be faced by the Food Safety and Quality Division under the Ministry of Health Malaysia to ensure food hygiene and safety is guaranteed across the movement control order is carried out. There are three challenges that I will underline that has been found and relate with our topic, which is food safety. First challenges, enforcement activities are reduced. Restricted inspection of food establishment by Malaysian food safety and health officer, also boundaries that exist due to the deployment of enforcement officer because the regulation of the movement control order. After the government announced that Malaysia would create movement control order due to the COVID-19 epidemic, some regulations were issued, such as during the beginning of movement control order, which is enhanced movement control order EMCO, the government had set some rules, such as all residents were not allowed to leave the house except one in order to get food supplies and necessities in business premises that allowed by Polis Diraja Malaysia. Also, as we know, as stated in Standard Operating Procedure by EMCO, the occurrence has reduced enforcement activities of an officer who has been authorized to perform their duties, such as authorization to check any premise that seems to be a food premise like a restaurant, a food processing business, a market or other similar establishment. Since the Food Safety and Quality Division enforcement activities have been reduced, some food operator and food processing establishment will simply ignore and disregard the food safety guideline provided by the Food Safety and Quality Division of the Ministry of Health Malaysia throughout the movement control order. And according to the Sinar Harian newspaper reported on August 12, 2020, that the Terengganu Health Department had recently ordered 8 food establishments in Kemaman and Dungun to close for 14 days for operating below the evaluation standard. The agency issued the closure order under Section 11 of the Food Act 1983 by following a 2-day integrated operation of clean food premise in Kemaman at Dungun. According to the Cik Ganesi 3, by following a 2-day integrated operation of clean food premise in Kemaman at Dungun. According to the Cik Ganesi date, Terengganu Deputy Director of Health, Food Safety Quality Division, 47 food premises were examined at the same time and 53 offence notices were issued for various violations of the Food Hygiene Regulation 2009. And according to him again, this operation aims to ensure that food premises that trade during the rehabilitation movement control order comply with the prescribed level of cleanliness. This is evident that the delay in enforcement during enhanced movement control order has a significant adverse impact on food safety and quality division due to the many failures and mistakes committed by food producer and food premise owner as a result of not following the guidelines set after enforcement inspection conducted after Malaysia moved to RMCO phase, when the standard operating procedures state is all sector and activities are allowed except the negative leave. However, Malaysia is now in an endemic phase that has provided much relief to the people and restored normality to all business factors. It is expected that the enforcement authorities take full advantage of this once in a lifetime opportunity to complete regular enforcement activities. So, because the Malaysia are aware of their role in ensuring food safety, and in short, the more enforcement efforts are conducted, the more food dealers will follow by food safety legislation as long as COVID-19 is in Malaysia. So we go to the next challenges, which is taking food sample for lab inspection to determine the level of food hygiene and safety become limited. As we know, authorized officers are permitted to take food sample for lab testing under the Food Act of 1983. Food sample will be collected from manufacturer or place that serve food in any form and also including packaging food. Among the analytical service in the food lab are such as food additive, food packaging, biotechnology and others. Food sample will be sent in approved lab by government and the result of the analysis will be provided by an authorized officer to the owner of the food vendor. Taking food sampling becomes difficult when the process of food dishes is made at home and sold online during this pandemic. While the country is in the pandemic phase, the society takes the opportunity to do business at home as a survival, and among the popular business is the sale of food. However, the business from this house will be high risk in the issue of poisoning because there is no confirmation that the food is safe due to the food samples cannot be analyzed for hygiene and safety with the cooking ingredients used by a lab certified by the Ministry of Health Malaysia. For example, in Terengganu, involving 99 victims from 20 different families and claim one died. All the victims are believed to have bought pudding weight during the months of Ramadan by online purchase. Authorities have taken sample of the pudding weight to analyze the cause of the food poisoning. After analysis, the authorities state this was because of the age that had expired, which was more than 2 weeks. All victims of poisoning have suffered from salmonellosis, which will cause a pain or abdominal cramp, diarrhea, sometimes that mixes with the blood, nausea, vomiting and high fever, and can cause death in certain cases such as elderly, children or patients with at-risk disease. However, as we know, after Malaysia is in the endemic phase, online sales are becoming more vibrant and popular due to the convenience of food delivery application that just can be downloaded in smartphone such as Food Panda and Grab. Of course, it becomes difficult for food analysts to take food sample from one vendor to another. Therefore, the Food Safety and Quality Division should make it mandatory for online food business from home to follow the food safety guidelines such as home-based food state by the Food Safety and Quality Division immediately. This is because online food sales are growing at the moment, and in order to avoid the issue of food poisoning during this COVID-19 outbreak. Last challenges is sale of health food products that contain toxic substances and use false information labels on food for profit without considering the impact back on buyers. After the COVID-19 virus existed in Malaysia, the community has done various ways to prevent themselves and family members from being infected with the virus. Among the methods used such as using traditional medicine, buying food products for health and other medicine. But there are irresponsible parties taking advantage of this pandemic era by producing health food products that contain toxic substances and using false information labels on food to make a profit without considering the impact on consumers. The Food Safety and Quality Division assert that no health food product can treat COVID-19 virus disease because COVID-19 virus can only be treated by the hospital with the help of legal medication and advice from a doctor. For example, the Ministry of Health Malaysia has issued a list of banned products. This list of products aims to provide information and warning to the public related to the health products and food or beverage products that contain poison or are not registered with the Ministry of Health Malaysia. These products have been confiscated in the market and banned from sale either by agents or retail by the Ministry of Health Malaysia. According to a Metro News report, Health Director Tan Sri Dr. Nur Hisham Abdullah said the food products were suspected to be mixed with scheduled poison such as sildenafil, tadalafil, dexamethasone, and prednisolone. All of these poison pose a danger to consumer of this health product. And according to him again, Director General of Health, he further recommend that consumer immediately see a doctor for examination and follow-up treatment. As we know, product owners will be prosecuted for violating the Nutrition Act 1983 under Section 13. Any person who prepares or sells any food containing in or on in any substance that is toxic, harmful or otherwise detrimental to health commits an offence, and on conviction shall be liable to a fine not exceeding 100,000 ringgit or to imprisonment for a term not exceeding 10 years or to both. These have also been listed as product that use false labeling. As a result, product owner will be liable to imprisonment for a term not exceeding 3 years or a fine for or both to violating the Nutrition Act 1983 Section 16 false labeling. As we know, after the pandemic phase passed, Malaysia was declared to have entered the endemic phase. Therefore, it is a hope that the enforcement authorities need to make a large-scale operation to prevent products that mix banned and dangerous substances immediately, because in this endemic phase there will be more sellers or products who do not have approval from the Ministry of Health Malaysia because they want to bear losses during the pandemic phase. In fact, there must be a handful of people who believe in fake advertisement for the product in order to protect their health during the COVID-19 epidemic. So I think that's all from me. Thank you.
Thank you, Iza. Now I will explain about the solution. Consumer relationship with food have changed because of the COVID-19 pandemic, either through purchases, improving cooking at home, or taking precaution when shopping for food, delivering food, and eating out. Firstly, the legislature is responsible for tightening the current food regulation, which is Food Safety Act that enacted in 1983. Food legislation needs to be adjusted while maintaining food safety during pandemic and endemic. The authorities must work closely with the food industry to assess whether the amendments are temporary or require adjustment to food policy, and have regular communication with the food industry to determine whether the changes are permanent. rules on illegal health claims, and the premise that food labeling should not mislead customers. For example, if enforcement is tightened, premise that do not comply with the provision of standard operation procedure (SOP) may be subject to fines, penalty, or premises closure instructions. Secondly, food delivery are also important to prevent COVID-19 infection from spreading amongst merchants and customers. Systematic food delivery is essential to limit the risk of virus transmission during payment transaction. The usage of proper gloves, sanitizers, and disinfectants after food delivery transaction can reduce the risk of virus spread. For example, customer can place their order through restaurant website. And mobile apps like Foodpanda, GrabFood, Lalamove, and others to ensure the food reach safely from the vendor into the hands of the customer without involving any movement by customer. Home cooking are also encouraged the public to stay at home if there was no need to go out except if emergency by Ministry of Health. Next is the need for active and intelligent packaging. Following the COVID-19 outbreaks that struck, changes in consumer expectation for safe food have led to packaging technology advancement, and most manufacturers have used active, smart, and intelligent packaging to maintain the nutritional content, quality, and the freshness of their products. Consumers are concerned about the COVID-19 virus potential to live on the package's surfaces. This has resulted in the surge in the creation of antiviral polymers and biopolymers. For example, it was recently revealed that nanomaterial coatings of film containing copper, silver, and zinc nanoparticles have the ability to protect food packaging surfaces against COVID-19 contamination and thereby limit transmission. Lastly, hygiene practices from farm to home. Food industries can reduce the risk of COVID-19 infection. Cleaning, sanitation, excellent hygiene standard, and active packaging are all required, especially at marketplaces. Traders and management must always assure the hygiene of food and raw materials according to Health Minister Khairi Jamaluddin. The cleanliness of the kitchen or production area where food is prepared is important. For example, surfaces of utensil, packaging materials, interiors of transport vehicle, counters, and any other food workstation can add to avoid the spread of COVID-19. Ministry of Health requirements such as regular hand washing while changing goods, use of hand sanitizers, wearing masks, gloves, and maintaining distance at least 1 meter, the most important prevent transmission of COVID-19 virus. Next, I will pass to Aidil.
As a conclusion, food is not just an agricultural and commercial commodity, but it also may be harmful to people's health. As a result, the ability of food sector to maintain growth depends on the performance of food safety initiatives aimed at protecting customers from health concerns and fraud, as well as eradicating the food trade. The importance of food security or risk management should not be underestimated, given the potential impact on the economy and public health, particularly during food security crises. The Reformation Policy of Food Act 1983 during the COVID-19 pandemic has faced many challenges and faced many processes. Thus, the government has taken various measures to reduce the infection during the buying and selling of food from farms to homes during the COVID-19 outbreaks. That's all from us. Thank you.